All right, so here we are, CPT 2020 musculoskeletal section. So this is your musculoskeletal. I'll start with just kind of getting into the different areas, and then like I've done on previous videos, as we get fairly far or get a few sections under our belt, we'll do some practice examples, coding examples, so that we can get used to how the codes are applied. Musculoskeletal with this professional edition has some really good pictures or diagrams, illustrations, great to take notes on. We are very much getting into needing to know or have a good understanding of medical terminology, your prefixes, your suffixes. Your suffixes very much give you the action. Ectomy means removal, otomy, incising, lysis, removing. That kind of stuff that really has a good, if you have a good grasp on the medical terminology, you'll probably do better and be able to catch stuff faster. If you don't, again, get a spiral notebook. When you run into those terms that you're not that familiar with, write it in the spiral notebook. At the end of every day, go and research those terms, and you'll eventually build your own medical terminology foundation. Here is the index, scattered with some illustrations. The index at the front of most of these sections would probably be helpful here at the beginning, just learning the CPT. Eventually, you probably will not need them as much. So your musculoskeletal system starts with quite a bit of general definitions that are pertinent to this area. Then it starts with just a general section. Some of the key things to make note of within these guidelines. First, your definitions of closed treatment, open treatment, percutaneous skeletal fixation. As we work through the musculoskeletal system and get into the fractures, you will see that you pretty much have three choices. You have a closed treatment, open treatment, or percutaneous fixation. That's what you'll find. So these are a good definition of those. Codes for external fixation are to be used only when external fixation is not already listed as the basic procedure. So this is giving you some parameters of when you can use external fixation. Your excision of subcu connective tissue tumors, your excision of facial, however you say it, wherever you're from, or subfascial soft tissue tumors. These include simple and intermediate closures. So unlike your benign and malignant excisions in the skin section that only include simple, musculoskeletal includes simple and intermediate. Remember, simple is a single layer, one layer closure. Intermediate is multi-layer. Could be 2 layers, could be 20 layers. So that they would be bundled in. So don't get caught in that. Also with your radical resection, resection's another word for excision, radical resection of soft connective tissue tumors, and radical resection of bone tumors. All of these will include your simple and intermediate closures. Again, I put some notes in just to kind of trigger me. Maybe I haven't been in musculoskeletal system for a while. An open fracture means the bone protrudes or can be seen. It protrudes through the skin, or it's an open enough wound that you can see the bone. So that's considered an open fracture. Closed fracture doesn't go through the skin. You cannot see the bone. Okay, so your wound exploration. So this is just a general section. Your wound exploration has some very specific guidelines on when you apply these codes. And it's telling you that you only use these codes for surgical exploration and enlargement of the wound. So if they're exploring the wound and didn't make it larger, you wouldn't use here. So this, you've got to have an enlargement, an extension of the dissection. You have to have debridement, not all of these at once, but you have to have one of these. Debridement, removal of foreign body, ligation, coagulation. There's a lot of different scenarios that you could use these for, but keep in mind, this is for trauma. This is those penetrating gunshots, stabbings, that kind of stuff. Moving on, we have our introduction section. Remember what I've said, introduction and other procedures, a little bit of a catch-all. We'll get in here and maybe do some coding examples. If you just kind of look, there's a lot of injections in here, different kinds of injections, some needle insertions, removal of foreign bodies from a muscle or tendon sheath. So these are a little bit of a catch-all. They're kind of all over the place. Then starting over here with 20600 is your arthrocentesis. Now here's a time when knowing your terms would help. Centesis, the suffix, means drawing fluid off. Arthro means joint. So this is aspirating or pulling fluid out of a joint. So if you do an arthrocentesis of the knee, they're probably inserting a needle and withdrawing fluid. You've got fluid on the knee. These are divided by small joint, intermediate joint, and major joint. So again, I've underlined those because, like I've said in other videos, I have to go through here and I see all of them start with arthrocentesis, so I have to read through and see what makes them different. So the next time around, I'm like, oh yeah, I've already read these. Oh yeah, that's right, that one is the small one, or whatever it is. Okay. In this section is some external fixation systems, your halos, whether they're 4-prong or 6, 8, 12-prong. I will say, beside code 20661, that is a 4-prong. That's just your basic halo. Good pictures in here to kind of help get in your mind how stuff is put together and used. A picture kind of what the words are that you're reading. I think it's very good. I will say I do have another little tidbit that I used to do when I taught on site at the college. I would pull up YouTube videos. So they're just short, 2 or 3 minute. They're not super gory, but if I just couldn't get my mind around a procedure, I would Google it on YouTube, find the little 2 or 3 minute blurb, show that in class. It wasn't too involved, but it really did. After we would read the code, we would talk about the code, and then we would watch a video for the code, and it really did help kind of solidify, oh, that's what they're talking about, kind of a deal. Not everything can you do that with, but there were some that you could. Laparoscopic surgeries, any of them will help you get in your mind the trocars that they put in the abdomen, that kind of stuff. Okay, into these grafts, this is different kinds of grafts, but your bone grafts are in here. So there's a couple of notes that you need to write in. Code 20900, this is bone harvesting. Bone harvesting, and it's the donor. So if I'm going to give a bone to someone, give part of a bone, that kind of thing, that's who you're talking about, the donor site. You have some add-on codes, 20930. These are morselized allografts, so same species, morselized. Another word that you'll see for morselized is cancellous. Cancellous, CANCELLOUS. And that means they're morsels, they're tiny bits of bone that they pack in. or use to fill. Okay, morselize, think of it as Keebler elves. I've done this on videos forever. Keebler elves have the morsels of chocolate, just the little chips. That's what morselized bone grafts would be. Turning the page, 20931, your structural allografts, that's cortical, C-O-R-T-I-C-A-L. Those are your bigger chunks of bone that are actually going to support the spine and support significant weight. Then you have your autografts down here, same thing, morselized and structural. Okay, so that's the general area, not necessarily geared toward any particular body part. So here's our first body part, the head, and we're going to work our way down the body like we have in other sections. So the head, this is going to be different areas applied to that body part. So we have the skull, facial bones, and temporomandibular joint. Sorry, Saturday night, and I'm all twisted up. Temporomandibular joint, TMJ. So your excisions, this is foreign body, tumors, that type of stuff. You will need to put a note in here if there's a foreign body being removed from these body parts. It's probably going to be back on code 20520. Just kind of make yourself a note. Anything pertaining to the head, we've got head prosthesis, we have introduction or removal codes, we have repair codes, revision codes. This could be fixing orbits, your eye orbits. This could be fixing chins, all kinds of stuff, anything pertaining to the head in here. Then we have our fracture section. So this is dealing with fractures of the head, noses, jaws, cheekbones, eye orbits, all of that on the head. And if you just kind of look, closed treatment, open treatment, closed, open, percutaneous, open, closed, open. And that's why these first, if I can find a page, that's why these first definitions on that first page are so drastically important, because every fracture section for every body part in here is going to have open, closed, and percutaneous. But it makes it a little bit easier to navigate. Then we get into the neck. That's our next body part. Neck, the soft tissues, and thorax, so chest. Again, we have the same sections. Incision, excision, pertinent to only these body systems. Repair, revision, fractures, not a lot to fracture there. Then we get into the back. And then from the back, we go into the spine. This is a heavily used section for fusions, spine fusions, whether they're cervical, thoracic, or lumbar. Make sure that you read your guidelines in here. These guidelines are going to tell you that if there's a bone graft done, you code additional. This tells you if there's instrumentation like rods, pins, cages put in, you code additional. This is where you find out all that information. So still in the spine, incision, excision, osteotomy. This is another term. Otomy meaning cut into, osteo meaning bone. So this is a section cutting into bone, maybe spinal deformities, that kind of thing. We have fractures, dislocations of the spine. We have vertebroplasty, plasty meaning surgical repair, vertebro meaning vertebrae. Then we get into our arthrodesis. So let's talk about that word. Desis means fixation. Arthro is joint. So in this area, this is arthrodesis of the spine. So these are fusions. They're fusing the spine. There are 5 pieces of information you need to know in order to accurately find a code. I write them down here, write them wherever you want, on a sticky note, or whatever. But for me, it helps me when I get steps down. Then once I go through the steps, I'll know what I'm doing, and I know that I'm catching all the codes. So when you're looking at your op report or your scenario, the first thing you need to do is find the approach. And what I mean by approach is, see, lateral, that's from the side. Anterior, that's from the front. Posterior, that's from the back. So you have to know that approach. How's the patient laying? If they're laying on their stomach, then they're probably doing a posterior approach. If they're laying on their back, then they're probably doing an anterior approach, okay? The second thing you need to know is, do you need to go to the nervous system to pick up any codes? Did they do a decompression of a disc? Something like that. You may or may not. That's about a 50-50 shot. The third thing, did they put in a graft, that bone graft? And if they did put in a bone graft, was it morselized or was it structural? The fourth thing, did they put in instrumentation? And we'll come to those codes in just a minute. And then the fifth, did they do a test called evoked potentials? And when we turn the page, you'll see I've made myself a note where that code is so that I remember to code it. But essentially what that is, they work on your spine, they fix what they think was the problem, and then they try to evoke nerve endings and movement or senses to make sure that they've restored full function. That's in a nutshell, very layman terms, what those evoked potentials are. So those are the 5 things you need to know when you're performing an arthrodesis. I've come through here, I have these numbered 1 through 5. So like over here, I put number 3 because this is some guidelines about number 3. Over here is guidelines about number 4. That's just kind of what I do. Okay, so let's see what other notes there is. So that was still your anterior, posterior, and lateral approach. Now we come to the spinal instrumentation. Again, it's telling you that if you've used a bone graft, go pick up that code. If you're using instrumentation, pick up the code. They're telling you, again, not to leave those codes out. This is the specific spinal instrumentation section. There are 2 ways that you can have instrumentation: segmental and non-segmental. And they have some good pictures with these. So here is a non-segmental. So they're doing it level at a time. Okay, here would be segmental. Fixation at each end constructs one additional body. Here, fixation is at each end of the construct. Here you have multiple segments of it. You see, it's just one big. This has multiple segments. So you need to be able to extract that from your documentation and then just plug it in. Where do I have my evoked potentials? Have I already missed where I had it written? Maybe. I don't know. Oh, yeah. Good Lord. Down here at the bottom is where I have my evoked potentials. And I just, like I do with a lot of things, I link up the numbers so that it's there. I know to go to it. Of course, if I see it, I didn't just see it. So it's 95925 and 95926. Could be both of them, could be one of them. Just depends at the level, what's going on, that kind of thing. Okay. Now we're going to be at, I will make note, 22856 is a total disc arthroplasty. So that's an artificial disc going in. 10 years ago, almost unheard of. Nowadays, more common. Okay, so out of the spine into the abdomen, there's not much here, just a few excisions. And this is the abdomen as a body area. This is not the liver that's in the abdomen or the small intestines that's in the abdomen. Okay, this is not any organ systems within the abdomen. This is just the abdomen as a whole, as a body area. So your shoulder. Here you have your shoulder, same kind of thing. Incision, excision, introduction, removals, repairs, fractures. And if you see the fractures, open treatment, open treatment, closed. We'll have a percutaneous here in a minute. Well, no, maybe not. I don't see any percutaneous. So only open and closed, which is okay. Manipulation, arthrodesis. This is if they have to fixate that joint. Amputation, potentially. And then we go into the humerus and upper body. So remember, we started with the head, went on and did the spine, then we went into the shoulder, now the upper arm. Same areas, incision, excision, introduction, repair, fracture codes, closed treatment, open treatment, percutaneous skeletal fixation, closed treatment, percutaneous, open, closed. You see, very common. Into forearm and wrist. I do have a note here that if you're looking for carpal tunnel procedures, you need to go to the nervous system. You wouldn't go to musculoskeletal. Kind of the inclination is to do that, but you don't. Okay, so this will help you get to the right place. Again, this is our body area. Same section, same thing. Fractures, dislocations. Again, open treatment, closed treatment, percutaneous. It's very, very consistent. Hands and fingers. Code 26055 is for trigger fingers. Trigger finger. I underline that. That way, if I get to my body part, I can go straight to that. Introduction, repair, revision. Then we go into fractures and dislocations. Then we're done with the upper body. We go into the pelvis and the hip. You have to read to see if the hip goes with the pelvis, if the knee goes with the upper leg, or the knee goes with the lower leg. And I'll show you that in a minute. But it's helpful to look underneath here, and then you would know specifically what's going to be under there. So here's your pelvis, incisions and excisions. Introduction, removals, repairs, fractures, dislocations, closed treatment, open treatment, percutaneous fixation. Really good pictures. If you sit and read the pictures and study it, it really helps stick in your mind what's going on, what the fracture looks like, how they're repairing it, and it makes some of the words make more sense, in my opinion. Your femur and knee joint. Okay. Repair, revision, fracture, dislocation. Then we go into the lower leg, tib, fib, and ankle joint. Same type of thing. Your repair, your fractures, then we get into foot and toes. Same thing. Very, very consistent. Musculoskeletal is not too bad. Not too bad. Really good pictures here regarding bunions. The hallux valgus, that's a bunion, or bunionectomies. Really good pictures. Fractures of that foot and toes. Toe amputations. Then we get into, we're kind of out of the body systems to some extent. We get into application of casts and strappings. Again, these guidelines are imperative that you understand, because you cannot code a cast or a splint or a strapping at the time that they fix the fracture or dislocation. if during definitive fracture treatment, if during definitive fracture treatment they put on a cast or a splint, you do not code in this area. You only code in this area if it's a replacement. Maybe they put a cast on, went home and got in the shower, and they were told not to do that, so it ruined the cast. Well, they have to come back and have a replacement put on. Now you code in here. It tells you here that this is geared toward replacement and not to code it if it's put on at the time of definitive treatment. This is very important. They will try to get you on the board with this. I promise you they will. I do want to look at two codes here, because early on, 4 or 5 videos ago, I had talked about having this procedure handbook, and I know this is old. It's 2016, so buy it 2020. I have a 2020 diagnosis one. I just haven't really had to get a procedure one yet. But what I will say, so say you're reading along here, and if you look at code 29125 and 29126, this is application of a short arm splint, forearm to hand. One is static and one is dynamic. And you're like, what in the world? What makes that different? Because chances are your documentation may or may not give you those words. Hopefully they will, but they may not. So this manual, a coder's desk reference, if you go to these codes, 29125 and 26, it will explain to you the difference. Static, it just stays still. Dynamic allows for some movement. So that's the difference in them. So I wanted to be able to show you how useful this book can be. And that's the kind of thing that you can use it for. It has been vitally helpful to me when I'm looking at two codes that appear very much the same. But it may tell me that one actually is dealing with the tendon and maybe one's dealing with the muscle. Or maybe one's dealing with the tendon of a lower arm and the other's dealing with the tendon of the upper arm. Something like that. Very, very, very helpful. Okay, so cast and strappings, we don't do at the time of definitive treatment. That is a huge no-no. You have to write that down. You cannot do it. Then at the back of this, and I guess I haven't stopped for practical application. I guess we'll go back and do that. At the back of the musculoskeletal system is all the endoscopy arthroscopies for all the body parts. So if they're doing a scope on any part of the musculoskeletal system, all of them will be back here in the back. They're not underneath the body parts. So it starts temporomandibular joint, shoulder, and then it just kind of flows. Here's elbow, wrist. Here is knee. This starts all the knees. We'll talk about these notes in a second. Goes down to the feet, talking about a plantar fasciotomy. So that's just kind of how it flows. In this section with the knees, there's a couple of notes I put in only because knee arthroscopies are kind of hard for me to code. I'm very honest about that. So I have to make notes so that when I see those words, I'm like, oh, that's what I need to pick up. So code 29874, this in the doctor's documentation, you might see it as plica removal, P-L-I-C-A, plica removal. 29879, this is drill pick holes. They're drilling some holes. And then I really want you to look at the difference between 29880, 29881, 29882, and 29883. In parentheses, it says medial and lateral, medial or lateral, medial or lateral, and medial and lateral. Very important that you see the difference in those ands and ors. Okay, so now let's do some practice. We'll do some practice. So under the general, we're also going to see some examples of separate procedures in here, which I think will help you see how to apply those as well. So let's start with our scenario would be the physician performed an exploration, penetrating wound, neck. So exploration, penetrating wound, neck. So this would be, remember your wound exploration codes are here under general. So 20100 is exploration of penetrating wound, and it says separate procedure. So anytime you have the separate procedure in parentheses, that is a warning that you're not going to code this if you've done or if there's a procedure that this could be bundled into. If this is the only thing being done, the only code, the only action being done, you can code it, it's fine. But that separate procedure is warning you that, hey, this may be bundled in something else. Okay, let's do another one. Open bone biopsy, superficial, left femur. So open wound, biopsy. So under excision, here's my biopsies, but it's of the bone, open bone. So I got to get to bone, and it's going to be superficial, left femur. So biopsy, bone, open, superficial. So I've been able to plug all of that in. And do I have a femur? Bone, open, superficial. So these are the suggested ones. I don't directly have the femur listed here. I have a femoral shaft, but that is deep. So I've got to stick with the 20240. So for me, I might go in here and put IE femur if it's superficial. That's just something that I would do anytime I come across stuff like that. Let's do one more. Patient received a cortisone injection to a single trigger point, which consisted of the trapezius, deltoid, and latissimus dorsi muscles. So this is trigger point injections. So remember, your introduction and other procedures sections usually have that kind of weird stuff. So here's the introduction section. So I need a injection of trigger points. So here's injection, single or multiple trigger points, one or two muscles. Let's see, I had trapezius, deltoid, and latissimus dorsi. So I have three muscles. So 20553, multiple trigger points, three or more muscles. So that's the code that I would use, 20553. Yay! Okay, let's do some out of the head. Let's get to the head. And we'll do a spinal. I think I have a spinal in here. Okay, excision of two facial bones due to bone abscess. So excision of two facial bones due to bone abscess. So facial is under head. Excision of bone. So this is excision of tumors, soft tissue. Excision of bone for osteomyelitis or bone abscess. So we're getting close. So here is facial bones. So our scenario was excision of two facial bones. So that's it. 21026. All right, let's do another one. Reconstruction mid-face, Lefort 2 with anterior intrusion. Reconstruction mid-face, Lefort with anterior intrusion. So the Leforts, that would be repair, revision, and reconstruction. The Leforts are in here. I go through and underline them. So this is a Lefort 2. So I've already underlined my Lefort 2. So this is reconstruction mid-face with anterior intrusion. And that has it all. So 21150. Perfect. Perfect, perfect. Okay, let's go to the neck. Let's get through here and try some in the neck. Hyoid myotomy and suspension. Hyoid myotomy and suspension. So let's talk about those words a little bit. If you've watched Bones or Grey's Anatomy or something, the hyoid is usually what gets broken or damaged when someone's strangled. So we've probably kind of heard that. Myotomy. Otomy meaning incision, myo meaning muscle. So this is a cutting into the muscle and suspending. So in the neck, cutting into repair revision, maybe. Yeah. 21685, hyoid myotomy and suspension. So chances are something had happened and they had to reconstruct or replace, repair that area. So that would be your code. That was a hard one. This is one of those, the words, and you're just like, what in the world is that? You know, it's just one of those weird things. We all have them. I don't care how long you've been in the CPT or how long you've been coding. I've nursed half of my life. Looking at words like that, you're like, what in the flip is that? So that is something, if I was doing this every day, I would probably go and really research so I would have a better understanding. This is also one of those codes that if you went into this Coder's Desk reference, you might be able to get some kind of layman's terms for what's going on. That's another reason why that is such a good resource. Okay. Closed treatment of sternum fracture. Closed treatment of sternum fracture. So we're neck and chest, or thorax, chest. Chest has the sternum. So fracture, I have to be under my fracture. So I have my body part. I have my section that I'm under. So now I just have to find sternal fracture. So I look through here. And it's closed treatment of sternum fracture. So there it is, 21820. All right, let's go to, let's do a spine. Okay, let's get in the spine. Let's see what we're doing here. Patient underwent arthrodesis. So let's just, before I go any further, let's get to arthrodesis. Okay, so now we're where we need to be. Patient underwent arthrodesis of L4, L5 interspace. So that's lumbar levels 4 and 5, or that they fused that level together, those two levels into one level. Posterior interbody technique laminectomy was performed. So posterior, remember, that's our first thing, our approach. We have to know if it's side, front, or back. So it's posterior. Let me go through. Posterior interbody technique laminectomy was performed. Discectomy was also performed to prepare the vertebral interspace for fusion. So let's get under our approach. So we're posterior. So we're going to be looking for lumbar, arthrodesis, lumbar. Here's a lumbar, but this is arthrodesis posterior or posterolateral single. They did more than that. So let's see. Here's arthrodesis posterior interbody. Ooh, we're getting closer. Including a laminectomy. Well, we know that they did a laminectomy to prepare interspace. Single interspace lumbar. So this is our code, 22630. What they mean by additional interspace. So let me write this. You know me and my note cards. So the lumbar spine has level 1, 2, 3, 4, and 5. That's how many vertebrae there are in the lumbar. The spaces, this is a space, this is a space, this is a space, and this is a space. So there are 4 interspaces. How I remember it is my fingers. If this is lumbar 1, 2, 3, 4, 5, these are my interspaces. And so when they're talking levels or interspaces, you count up these spaces. You're not counting the actual vertebrae. So that will kind of help when you're trying to put add-on codes. So if they did L1, 2, and then L2, 3, there's 2 interspaces there, L1, 2, and 3. So they fused L1, 2, so they've gotten rid of that interspace, and then they fused L2, 3, so they've gotten rid of that interspace. So for that, you would code 22630 and then 22632. Okay, so that's how you would use those. Hopefully that helps a little. Okay, let's do another arthrodesis and throw in a bone graft. Let's throw in something. So here's a posterior arthrodesis of L2, L3 with casting. Morselized autogenous iliac bone graft was harvested. Okay, so posterior here. And it was L2, 3, so it's only 1 level. I'm looking. This was for spinal deformity. I forgot to give you this. So here's your spinal deformity. So you have to get under that. Find your posterior with or without cast. They did put a cast on up to 6 vertebral segments. So this is your big dog procedure. Arthrodesis posterior for spine deformity with a cast, 1 segment. Now we did that morselized graft. So let's go back here and look at the skin. Look at the, they did morselized graft, and it was autogenous. So it was autograft out of themselves, not its same species is an allograft, autograft out of yourself. So the add-on code for the bone graft that's morselized would be 20937. So you would have 2 codes, 22800 and 20937. Okay. Again, if you are using your 321 coded book, it has fantastic examples of all of this, exercises for you, good examples that they put out. It is very, very, very good. They just about have an example for everything that you would come across. Okay, so now let's do more into the upper body. The physician performed an excision of a 4 centimeter subfascial abdominal wall tumor. The surrounding tissue incision was repaired in multiple layers with sutures. So number 1, what do we know about musculoskeletal excision of tumors? That a simple and intermediate closure is bundled in. So that intermediate closure that they told us about, or that multiple layers closure, is going to be bundled in. That's what I know for sure. Now this is the abdomen, so it's got to be one of these codes here. So it is 4 centimeter subfascial abdominal wall tumor. Excision tumor, abdominal wall, subfascial, but it is 4 centimeters. So I've got to find less than 5 centimeters. That's my code. I didn't read that right. 22900. It's funny how your eyes can get, you know, you're sitting looking at something, I had a dot in front of that, 0.5, and it isn't there. So 22900 is our code. Physician performed removal of a deep foreign body left shoulder. Deep foreign body left shoulder. So we are in our under our body part, which is our shoulder. Let's, I don't see, most of these excisions is for tumors and stuff. So my removal of foreign body is probably going to be under introduction and removal. So here is removal of foreign body shoulder subcutaneous. Now what did I say? I said performed deep, removed a deep foreign body left shoulder. So subcu is fat, deep. He gave the documentation gives us deep. So I'm going to go with 23333. So 23333. Now this was the left shoulder. So I'm going to put an LT on it because we have mirror images of our shoulders. They're two of a kind. All right. So 23333-LT. Let's do a percutaneous skeletal fixation of left Colles fracture. So you gotta know what body part has the Colles fracture. That's gonna be your wrist. So we gotta get over to our wrist. Let's find our body part. Here's our wrist. Percutaneous skeletal fixation left Colles fracture. So I have my body part. Now I have to get to my fracture and dislocation. Now I have to find a percutaneous skeletal fixation for that wrist. So I'm just gonna, what I do, I just kind of look at the words, the first words, and it kind of helps me get through the section faster. So I need percutaneous skeletal fixation of distal, Colles is in the wrist, so that's distal fracture of the radial fracture, and that's going to be what I'm looking for. This is where knowing what a Colles fracture is and specifically which bone it affects comes in very, very handy. If you did not know that a Colles fracture affected the distal end of the radius, this is where you would look it up and then make a note here and maybe put, I'll do it too, I.E. Colles. So now I never have to come back here. I know exactly where that is or what that is. Let's see, we have to put, so 25606, and it was the left, so we have to put an LT. Remember, I'm bad about those LTs and RTs. I'm good about the money ones, but I'm not good about the information ones. Okay, let's move into the pelvis and the hip. Hopefully you're kind of getting an idea of what to do with this kind of stuff. Pelvis and hip. So let's decompression fasciotomy of the lateral and posterior compartments, right knee. So that's going to be knee, not hip. I just picked one and started reading. So, okay, so this involves my knee. So I have my body part. Now I got to read this again. Decompression fasciotomy of the lateral and posterior compartments, right knee. So, looks like we're going to repair that right knee. That would be decompression fasciotomy. Sounds like it would be a repair. So I'm going to be under my revision and repair. And I'm going to look for Decompression. Here we go. Here's a decompression fasciotomy, thigh and or knee. One compartment. So what was it? We have lateral and posterior compartments. So we have two compartments. So 27498, decompression fasciotomy, knee, multiple compartments. So that would be both of them. So my code would be 27498-RT. All right, lots of people have bunionectomies. So let's do a scenario and look up a bunionectomy. Let's go on and get to our foot and toes so that we know our body part. Partial osteectomy to surgically correct bunionette involving the right fifth metatarsal head. So this is going to be within an excision because they're excising the bunion. Remember all these pictures, they're taking out so that they can straighten. Scraping and taking out and removing. It's probably sounds like something crazy. So this is a osteectomy. Ectomy meaning removal, osteo meaning bone. Osteectomy of bunionette. So let's see here. Osteectomy is what I'm looking for. So here's an osteectomy, partial excision, fifth metatarsal head. Is that it? Yes, partial osteectomy, surgical, to surgically correct bunionette. I have bunionette in parentheses. This is also a separate procedure. So this is another example. If this procedure was being done with a bigger procedure on that body area, you would not code this. This would be bundled in. And this was the right fifth metatarsal head, so I'm going to put an RT on it. So 28110-RT. Yay! We're almost done with musculoskeletal, believe it or not. Let's do a little bit further in the book. Let's do patient with diabetic neuropathy ulcers had rigid total contact leg cast applied. So this is going to be cast and strappings. Patient has an ulcer. They're not having a fracture treatment, none of that. So this is a perfect scenario to be able to use this area. So we're cast and strappings. This is patient with diabetic neuropathy ulcers had rigid total contact leg cast applied. So let's look. Cast, and this is going to be leg. So I got to get to my body part. Here's lower. So here we go. Application of rigid total contact leg cast. 29445-LT for the left. Let's do, that was a good example to be able to use this because you generally don't get to. Let's do a knee arthroscopy because they're so stinky. They're stinky to me. Some ortho people probably are like, yeah, it's no problem. For me, it's a little stinky. I'm a heart person. Okay, so I have my arthroscopy of the knee. This is the page I'm at. So let's listen to the scenario. Left knee diagnostic and surgical arthroscopy with partial medial meniscectomy. Ooh, I'm having trouble talking tonight. I swear I can say these words, usually without difficulty. So left knee diagnostic and surgical arthroscopy with partial medial meniscectomy. So we know we're at our knee. So we need to find meniscectomy. We know we're under, let's find our indented. So here, 29866 is our arthroscopy. So everything on this page is indented underneath there. That was a really bad place for a page turn. But all of this is arthroscopies, arthroscopy diagnostic, arthroscopy surgical, and then this is indented, this whole column under this one. kind of sometimes they're really hard to follow when you have to change the page. So we are under arthroscopy knee. So when they're telling you left knee diagnostic and surgical, that diagnostic becomes a part of the surgical. So you would not code 2, you would code the more complex, the higher one, which is the surgical. So here we're arthroscopy knee surgical, but we have to find the meniscectomy. So I'm going to travel here. So here's meniscectomies. They just did the medial. So it's not and. So it can't be 29880 because that's a meniscectomy with medial and lateral, and we don't have that. So it has to be meniscectomy medial or lateral. We have the medial. And it was a partial. So I've got to see. I don't think you get to use your partial in here. I think this is just the only choice that we have. 29881, and then it was on the left knee, so that's an LT. That one's kind of, I'm telling you, the knees are kind of hard. The partial part would probably really have me digging, but there is no choice of a partial here. I just want to make sure I'm right. I don't want to tell you something wrong. Okay, so that would be 29881-LT. So that kind of got us through the section with some practical applications. So next video will be respiratory, and I'll see you in the next video.